I'm Becky Malby, I'm a professor at Southbank University in the UK, and this MOOC prototype is a Health Systems Innovation Lab, the next generation of health services and the next generation of health leaders in the NHS in the UK. I started this prototype by interviewing chief execs in the NHS from the third sector, social care and health sector, about their major challenges. This quote probably epitomises the major dilemma for chief execs in the NHS, which is the relationship between the human stuff, people and relationships, and the money. Daily pressures tend to pull us in the latter direction, he said, whereas the longer term gains require us to focus on the people issues. A survey of CEOs showed these issues. One was, how do you promote a culture that energises staff? How do you work across commissioning provision? How do you have a different dialogue with the public and involve politicians? How do you respond to increasing demand? And how do you create a better understanding of the need of patients? In terms of the CEO role, the biggest issue was around working across health and social care, bridging the divide, caring for vulnerable people, engaging communities, managing the money, and spread and speed of change. Of the issues that they're trying to create and they're struggling with, things that really struck me was the difficulty chief execs have in giving up territory and power, and how they manage to turn new things into the old world very quickly and do new things like leading accountable care organisations in very old-fashioned ways sat around boardroom tables. So what we know from the ULab is the future's already here, we just can't always see it, and the next job here is to show some examples of what's around now. Altogether Better's community champions are in over 60 practices, 16 CCGs, working with 1,000 citizens, touching the lives of 500,000 people. And in this practice, Robin Lane, they've increased their patient list size by 4,500 people and see no increase in demand for either primary or secondary care consultations. At the Bromley by Bow Centre, a GP practice under social enterprise, they assume it's possible. They build self-esteem through the arts. They use time banking, community connectors, skills development, back to work, active citizenship, integrated services, social prescribing, young entrepreneurs. They create jobs and wealth and transform lives. Is the Netherlands' fastest growing model of integrated care, tackling the problems of fragmentation and shortage of nurses. They care for 70,000 people, 50% with some form of dementia. They've managed to get a decrease in unplanned care, 40% lower home care costs, 50% reduction in hours of care, and they've lowered their staff sickness rate. So why doesn't the NHS just replicate all these great ideas? Well, that's the challenge that we're going to tackle in this prototype, i.e. in the Innovation Lab. Here's a list of all the challenges that the NHS faces in trying to spread learning, but I love this quote from Alison from Altogether Better. She says, the biggest threat to scalability is that system leaders do not take the time to understand what is radically but subtly different about it and default to replace the new with the old. So what have we got to offer? Well, we've got to help people understand how to work at a system level, how to think in partnerships and in collaborative models of learning. We've got to give leaders the opportunity to work with new conversations, new perspectives, and get passionate about new ideas. We've got to help health leaders really understand the ULab model, particularly around prototyping. There is very little experience of rapidly testing, modelling, and then applying in the NHS. And finally, we have to take the lesson from Otto around using both evidence and emergence and generating not only evidence but stories and conversations that shape and influence policy. So the lab is going to connect the strivers and thrivers, people who are doing it with those that want to. It's going to provide some real support to learning. It's going to bring in the next generation of leaders. So the interviews are over, and I've now got a number of ambassadors supporting it, from policymakers at national level through to chief execs, clinical leaders, and citizens and service users. So we're ready to start, and that's our next step.
Created using Powtoon.